lateral and subthalamotomy and some nerve stimulations. Of course, as I mentioned, it is effective in highly selected ones and is not effective in all patients. Some dopamine agonists like selginine and bromocriptine is important. Of course, in the first year and after 5 years, they have only something about 10% effect in management of patients. The third disease I'm talking is multiple sclerosis, MS. New and most recent advances in treatment, as maybe you know, is beta-ferrones, interferon A1, AB, and Avonex, Rebif, beta-seron, copolymer, and intravenous immunoglobulins, and pulsed prednisolone are among the most recent treatment of multiple sclerosis. Of course, in advanced cases, the most important cornerstone of treatment is based on management of side effects like spasticity, sphincter disorders, blurred vision, which in new techniques of VRT, visual restoration therapy, could be important. VRT also important in stroke outcome in vision, blurred visions, which is important after brain injury, and cerebrovascular could be recently managed by visual restoration therapy. The next one I'm talking is about epilepsy. Besides of some new drugs like topiramate, neuropentin, lamotrigine, new technique of surgeries could be important in some patients. In medically intractable patients, partially onset over 12 years of age, VOC stimulation is a choice treatment of those patients. In epilepsy, surgery is new technique and most recent advanced. Of course, there is some contraindications for those surgeries for selected patients. I mentioned in next session. Dementia, most of them Alzheimer's disease, is very common. I don't mention about its incidence and prevalences here because I'm talking so briefly about recent advances in management. Some drugs approved by FDA, donepezil, memantine hydrochloride, and rivastigmine tartrate are among drugs that are approved by FDA for management of first phases of dementia. Of course, in advanced cases, we should treatment symptomatically because as yet there is no effective and certain management for it. In headache, after introducing our treatment, sumatriptan, and many other treatments, which differences are based on the onset of duration and long term of its effects, new treatment of injection of botulinum toxin could be important in some selected patients in migraine headaches. And Relotec and glutamate antagonist is only drug has been approved by FDA for ALS, one of motor neuron disease, which is a devastating disorder in neurology. Of course, there is many other aspects of recent advances in neurology I'll mention in next session. My email is davanlou, davanlou @yahoo.com. Please don't hesitate, even a question, call me.